Welcome to another episode of Future of Care. I'm your host, Dr. Arnab Paul from Homecare Association of India. Today we have a very interesting guest, Dr. Alexander Thomas, who happens to be the founder president of Association of Healthcare Providers India and also founder president of CAHO.
Thank you.
So you have been a surgeon. When you look back at your journey, what changed you from being a surgeon to a system builder?
Yeah, I've also been thinking about that. Yeah, I started my career. I started, of course, as an intern in the Baptist Hospital and went to do my PG and started as an orthopedic surgeon. This was more than some decades ago. And actually, it's been a journey from treating individual patients, then administration, and then trying to build systems, basically trying to improve the health of millions of people in our country. As I said, I started off as an orthopedic surgeon, but then I realized that many of the challenges that affected my patients were rooted in the healthcare system. One was insurance, one was reimbursements, one was patient safety, a few examples. So I realized that this were in the healthcare systems rather than medicine itself. Medicine itself is very simple. So that led me initially into hospital administration, quality improvement, and health policy. And I must say that along the way, Baptist Hospital is governed by CMC Velo. So I had the privilege, the opportunity of working with senior leaders in CMC Velo, and that really made me shift into my into from a primary orthopedic surgeon into policy level systems, etc.
Wonderful.
And maybe I'll go a little more during this journey. That three experiences actually shaped my journey. First was I discovered the power of institutions. I remember we were having problems with our government agency. They owed us money, so I went to meet the people in Delhi. They made me wait for almost about 2 or 3 hours, and then finally I was met by the clerk to the undersecretary. This is money owed to us, and I'm going to ask for it. So then we said, I discovered that it's getting together the power of institutions. So that is what actually helped establish organizations like the Association of Healthcare Providers. We now almost 20,000 institutions all over the country. CAHO, you already mentioned, has gone international. And there's one other organization called ANBI, the Association of National Board Accredited Institutions, which probably has had the most policy impact results out of the three. In addition to that, as a voice for senior citizens, I started Via Vikas. We are just in the process of setting up the Association of Healthy Aging.
Okay.
And more recently, this is the process, the Indian Society for Sarcopenia and Muscle Health. And of course, I was also instrumental in starting the climate change unit for PHFI Health. So these were this I discovered that if you go together, it is much more effective, and we network with each other. Second, I also discovered the power of policy. See, I think I've shared with you earlier that one of the things that did was that we introduced the communication movement in the country. So initially, this was after my book on communication, care, cure. So as a result of the book, many people asked for help. So we spent a lot of time and effort conducting workshops, sensitizing people, etc. And the real breakthrough came, and we were able to actually introduce it into the curriculum through policy change. So today, without the hassle of having to organize anything, it is automatically taught to lakhs of patients in medicine, undergraduate, postgraduate, nursing, etc. So that convinced me that policy is the way to go, and that creates a lasting impact. Well, apparently, since 2019, when this was introduced, the quality of children coming out are much better. Third, and a very important lesson I learned, is the power of collaboration rather than confrontation. Early in our journey with ANBI, that's the Association of National Board Accredited Institutions, we had a difference of opinion with the regulatory body, that is the National Board of Exams. We even went to court for that. We lost the case, but instead of remaining adversaries, we built a very strong partnership. And today, ANBI and the national board is cited as a model regulator stakeholder relationship. We've actually been able to do a lot of policy change. We were able to retain the autonomy of the National Board of Exams. We were able to get parity between the MDMS and the National Board exams. So that taught me that reforms are, uh, especially the government, fight with them only as a last resort. Try and work with them, engage with them. And collaborations, I think there are a lot of examples where it's really worked very well.
Right.
During COVID, we collaborated with all the other associations and with the government. And the result was phenomenal. We were able to help the smaller hospitals through the bigger hospitals. We were able to get accurate information. We were able to lobby for protection of healthcare workers. Then I also was part of the Karnataka State SDG policy and the task force. So we were able to do a lot of work. And one particular collaboration which has played huge dividends was the UNBI AHPI collaboration with the National Board of Examinations and the government of Karnataka. So we were actually able to make 32 taluk and district hospitals into teaching institutions. So that, to a great extent, helped reduce the shortage of specialists in Karnataka, and it has benefited millions of patients in our state.
Wow. You have helped shape quality in healthcare in India, right? Uh, so looking back, what are you most proud of your achievements in quality? Because I'm sure I know you have been associated with that NABH uh, thing institution. So what lessons? It's a follow-up question. What lessons from the journey do you think home care should learn today?
Okay, very interesting. I just returned from an NABH regional assessors conclave. So I was just talking to the youngsters there and recounting my journey. I started off as an assessor, and
Oh,
during my assessments of other hospitals, I learned so much, and we were able to implement it in Baptist Hospital to a great deal. And that's one of the reasons Baptist Hospital really flourished. Then I became a member of the board. Then I became an oversight committee member, and most lately the chairman of the grading technical committee on grading of NABH. So I've been very closely associated with both NABH and the Quality Council of India, and I've actually seen the change, the quality movement evolve over the past two decades. And if you ask me, one particular initiative here is the entry level certification. If you are aware, initially gold standard was available in NAPH and very few hospitals could afford it. And with my mission hospital background, I said, no, we need something for the mission hospitals. So started off with mission hospitals, but fortunately, the government QCI took it up, and now we have something called entry level certification, which is essentially these are safety standards, and it's a journey towards full accreditation. And today, thousands of hospitals have adopted it, and I'm also particularly proud that we were also able to influence the IRDA, Insurance Regulatory Board, that they have recognized this and they have issued a memo saying that this is mandatory for any hospital which actually is empaneled with them. So, and as you say, the next frontier is extending these principles beyond hospitals because home care is becoming so very important, and you're focusing on that. Home care, elder care, and long term care are expanding rapidly as the Indian's population rises. Working through NABH, through Via Vikas, through Dementia India Alliance, and in collaboration with the Ministry of Social Justice,
uh-huh.
we are trying to develop standards for these emerging sectors because patients deserve the same quality and safety that they receive in hospitals. So this is something that we're focusing enough. But having said that, I also want to mention that standards alone are not enough. One of the biggest challenges, and I'm sure you'll agree with me, is that the shortage of trained and certified caregivers. So I work very closely with the health sector skill council, and this year we are focusing on this aspect of competency-based certification programs. We are working again through Via Vikas, through Dementia India, and through the Association of uh, the Healthy Aging to try and ensure that safe, compassionate, and high-quality care for every patient is available. Because today, unfortunately, my guess is that three or four out of every uh, a home where there is a caregiver, it's actually dangerous because they're not trained, they have no idea of the needs of home care. So this is a very, very important issue which we need to, all of us need to sit together and ensure that this quality care is transferred to the house. Well, in a way it's difficult because there's no close supervision. So we have to come up with solutions to ensure that the person at home gets the best care.
Oh, right. Because see, caregiver home care is a different ball game because of this security aspect also. Uh, People are when they walk into a home, your caregiver, they are on their own. So that's a tricky part. They don't have the ecosystem to fall back upon. Something wrong happens or any mishap happens in the hospital at home. That's the tricky part. And as at Home Care Association of India, we are also thinking of doing something similar, taking it up. And I think we need to have some sort of a specialized training for caregivers, um, especially who visit home. It's very important. And coming back to a very interesting topic, aging, Dr. Thomas, everyone wants to live longer, right? So
Mhm.
what do we need to do to live longer? And I don't know whether longevity is becoming a buzzword, but let me play a devil's advocate here. India has so many lifestyle disease problems, right? We are almost a diabetes capital of the world. Are we not jumping the gun? I mean, we are putting the cart before the horse, thinking about longevity as well as we are not at the moment not thinking about taking care of the foundational aspect of healthcare. I mean, we are talking about lifespan more than the health span.
No, I think it's a very important question, and I just wrote an article for a newspaper where I said that our country, we cannot treat us way out of the epidemic of chronic disease. We cannot treat ourselves because it's just going to go on and on and on. So our priority, I'll put it in one word, it's prevention. And I have had the opportunity to work with CMC Vellore in lifestyle medicine. Again, healthy aging and longevity via Vikas and with the Indian Institute of Science and with INSTEM, we're doing a lot of work in this area. You must add quality to years, not the other way around. There's no point in just extending life. So actually, healthy aging begins much before old age. It's when we say it starts the day you're born, the day you're conceived.
Right.
So that's very important. And having said that, we also have to realize that India is very quickly becoming a nation of senior citizens,
Mm.
and we are not adequately prepared. So that was one of the reasons that I started Via Vikas, to be a voice for older adults, because unless you're together and a voice for older adults and to advocate uh, for healthy, active, and very importantly, dignified aging, I think that is something which is lacking in many areas. So we are actually following on the model in the USA and in Australia, where the Association of Retired Persons is very powerful and also impact policy. And so use that for the betterment of the seniors. And in fact, we have actually already have 8 lakh members in Maya Vikas, and we've already started influencing policy. On another note, it's important, apart from the area of senior citizens and Maya Vikas, it is important right from a young age to promote healthy nutrition, especially in this age of fast foods and all this nonsense that we get to. Healthy nutrition, regular physical activities. I remember when we were kids, I'm sure the case with you, that physical activity, exercise was a must. But in today's age, with technology that is being totally ignored, adequate sleep, stress management, avoidance of harmful substances, alcohol, and drugs, and very importantly, it has been discovered all over the world that stronger social connections make you age healthy. So we also need to focus on conditions like sarcopenia. I think a little bit about
Right.
sarcopenia for the layman. Sarcopenia is probably the most underdiagnosed condition, and as a result of sarcopenia, you get fractures, you're bedridden, you develop dementia. So that is the reason why I'm focusing on sarcopenia I'm part of the longevity vertical in the Indian Institute of Science and doing very important research with the Baptist Hospital and with INSTEM. So, healthy aging, for us to solve this problem and become a natural way of life, it should become a national mission.
Mm.
It has to include healthcare, education, workplaces, and communities. We have to get all of them involved. Investing in prevention today will certainly reduce disease, disability, and most of all, healthcare costs. There is just a simple estimate that we were doing that if 10% of the population starts seriously looking at lifestyle medicine, we will serve at least 30% of what we are spending in curative medicine today. So I think that is the way to go. the It's not very difficult. It just needs a will from the government, and it requires education of the public, including clinicians and other stakeholders.
Correct. It needs a very holistic ecosystem approach. I mean, we do understand it's a huge problem and we need to address it. Policy. And one of the interesting topic, I know you have been advocating for CPA being keeping out of the medical practice. You know, if we talk about trust, patients often feel healthcare has become transactional, and doctors feel they are overworked or overregulated. And somewhere in between, trust has become, I would say, the casualty. So where do you think, the trust deficit began, and how are we going to address it?
I think without doubt, trust is the foundation of healthcare, and I agree with you that he has been eroded considerably. A lot of reasons for it. I think earlier I was really fighting against this capitation fee because it you put in money, people expect a return on investment. Thankfully, the government has reduced that. The second is I think some of the hospitals are publicly listed, and the perception of the public is if they're listed, they're only for money. And of course, there are always a few bad apples in our community whose focus is on commercialization rather than on actual treating. My policy is very simple. If you look after the poor, God will look after you and you will make enough money, whether it's a chain or a single hospital. Uh, One thing that we all need to remember, all of us in the healthcare sector, that patients are they're the reason that we are there. And patients deserve safe, transparent, and accountable care. I'm not for a moment saying that doctors should be taken out of consumer forum because to reduce accountability. In our argument yesterday was a hearing, so we were preparing for it. We're saying that circumstances have changed. One very important thing has happened is that communication is now introduced. So every doctor is now trained in communication, and that uh, the communication is actually responsible for 70% of medical errors. It's not your skill. 70% is communication errors. So hopefully, this initiative by the NMC to introduce communication and train them that will reduce this erosion of trust to a great deal because that is very, very crucial. Consumer Forum has actually made it very, what do you say, that it's not achieved its objectives. Patient cases take years, and ultimately, who is the sufferer? It's the patient because defensive medicine has really increased healthcare costs. Just to give you an example, if I'm an orthopedic surgeon, if somebody came to me with a backache, I would have examined and then probably just given a few, maybe paracetamol, a day's rest, and they come back and see me. But today, orthopedic surgeon, will not do that. He'll have to cover his back. So immediately it will be a CT scan, maybe an MRI. So it actually, the cost goes up tremendously. And it's not only the monetary cost. Like when a patient goes for a CT scan, he's so anxious till the result comes back. So it adds a toll on the patient. I was reading an article the other day that this is a US article
Mhm.
saying that defensive medicine has also caused a huge increase in C-sections because during deliveries there are chances for more complications. So doctors suggest a C-section.
Yeah.
So ultimately, it is the um, patient who suffers. The other factor which not many people are talking about is that many youngsters are now not going into medicine because of the fear of litigation, the prevention and the violence against healthcare workers. So I think these are sometimes are counterproductive. So we need a better approach, and the circumstances have changed now with NABH in, with the Government Clinical Establishment Act. There are various other avenues. So we have to choose an avenue which preserves accountability. That's very important. There are no two ways about it. We have to be accountable, but at the same time, something which promotes mediation and effective grievance redressal and early resolution of disputes. This is very, very crucial. Otherwise, it won't work. So, and again, I want to say that one of my most satisfying contributions has been introducing this book on communication, getting it introduced into the curriculum. So, this better communication actually prevents many conflicts before they even arise. So, combined with quality systems and mediation, it can and it should rebuild trust while protecting both the patient and the healthcare professional.
Just curious, what's the status quo of this thing that you were advocating for, the consumer forum?
They heard it yesterday, and they're waiting for the response from the National Medical Council. So, we'll probably be heard again in about a month or so.
Do you think, Dr. Thomas, medical curriculum in India needs to undergo a major overhaul considering the new challenges?
Yes, yes, I think there is scope for a lot of it because today, at the end of the day, an MBBS graduate actually, because of the judicial decisions, because of the societal impressions, MBBS doctor really can't do much. 20, 30 years ago, MBBS doctor used to do minor surgeries, used to give anesthesia, used to counsel. But I think with the changing scenario, that has gone. So yes, I think that we need to try and bring back the concept of the family physician, strengthen the MBBS curriculum so that the doctor will be able to handle uh, everything, and like in the UK and the US, where a GP handles all this, and only when something specialized is needed that they come to the specialist. There is one of the challenges, but if you look at other challenges, uh, there's something now which I'm working with, and climate-related health challenges are also growing. We have to look at communication, ethics, and professionalism, but the climate change is something that we all have to take seriously because even WHO said that climate change is the greatest health threat of this century. And I've been working with PHFI, with the Health Environment Leadership Platform. We have had national conclaves on this. We've written a book on it. We're writing a book on climate change because most clinicians are blissfully unaware of the consequences of climate change. And if you look at just read the newspapers, climate change is already affecting health through heat stress, air pollution, infectious diseases, and extreme weather events. Every day we read about it. So hospitals and clinicians must learn about this and focus on being environmental sustainability. Related to that is antimicrobial resistance. Uh, Related to climate change, a huge amount of, I mean, the numbers are quite frightening. There are very few antibiotics left which we are able to treat disease because of the resistance. And doctors need our medical education. We need to adapt a little bit. We need to prepare doctors a little differently. Clinical excellence is not no longer enough. You cannot just be a good clinician. Tomorrow's doctors must understand communication. They must understand ethics. They must understand patient safety. They must be leaders, and they need to understand leadership. They need to understand digital health and also planetary health. And this is one of the reasons I think I've written about 8 or 9 books in different areas. See, the problem with, especially with doctors and other healthcare professionals, they're so focused on the profession that they know very little about anything else. They know very little about finance, They know about patient safety, about technology,
Mhm.
lifestyle medicine, and other emerging areas. We've written books on all this to try and empower the doctors. So ultimately, we have to develop doctors through a curriculum to not only excellent clinicians, but leaders capable of shaping better healthcare systems in the country.
The other day, I was having a chat with Dr. Chandy. He
Mm,
introduced, he said, or rather, we lamented that he said we need to go back and bring back that old Dr. Saab system.
mm.
So I'm just wondering what happened to the typical old bedside manners. Are we romanticizing the past too much, or there's a way to learn from that?
No, no, I don't. See, if you look at our track record, the old family physician played a very crucial role, not only as a clinician, but also as a counselor, and they could talk to him.
Correct.
So the track record is there. But I think over the years, with commercialization, with technology, with a mismatch between what's happening at the policy level, what's happening on the ground, things changed. And one of my objectives is that we should try and get back into the old system. Unfortunately, some of the drawbacks of the older system was that uh, communication was handed from one generation to the next, and it always wasn't good. Like orthopedic surgeons are notorious for their communication. But I think the first step and a very important step is that there is formally introduced into the curriculum, and it's the first important step in trying to regain trust between the doctor and the patient. And for that, the doctor has to be empowered in leadership, in transparency, ethics. So I think it's a matter of time, but I think the journey has started. And ultimately, I think one thing, if all of us in the health sector remember one thing, everything will fall in place, and that is that the patient is central. In fact, I was sitting at another meeting in Mangalore, and one of the very senior orthopedic surgeons said, "If you say that your patient is your God, everything else will fall into place." So I think it's not very difficult, and uh, we've started. Let's hope it works out.
That's a very interesting thought, because in India, people do look up to doctors as gods, and that's been the whole idea so far. Um,
That should change. No, it should be the patient is God. And
right.
then I think automatically the doctor will become God again.
Yes, that's one way of looking at it. What's your favorite
Favorite?
place
Uh, I'd say home in Bangalore.
in Bangalore? Okay.
Yes.
Your favorite book that you would recommend?
I would recommend to all my clinicians and other stakeholders to read my book on communication. It's almost become a bestseller. I think it's 9,500 copies. Another will become a bestseller. It's very simple. It's been appreciated. Not because I wrote it, I edited it. We got experts from all over to read it. I would suggest that all our stakeholders and health sector read it.
I will definitely. Your favorite food, sir?
I
Your soul food.
later out I say that what is the term that I like seafood. So seafood is whatever I see I like.
One
Yeah, not
habit
nothing in particular.
right. One habit you wish every doctor had, especially in India, or should inculcate.
Lifestyle as medicine. I just put it as one word as lifestyle as medicine. It's very important for healthcare providers to look after their health. So when I say lifestyle medicine, it's one word, but it's sleep, nutrition, exercise, mental health, and networking.
And the last one, sir?
Social networking. You
Social
know, yeah,
networking. Yes.
yeah.
Yes. And just a hypothetical question, Dr. Thomas. If you were given a chance to take one big decision for healthcare in India, policy-wise, what would you implement?
I actually have got a. I'll just mention four or five. You can choose the best one. First
Okay.
is make prevention and lifestyle the foundation of healthcare right from school. That is very, very crucial because prevention is the best cure, and that will make a difference from the beginning. Second is, I think, strengthen primary care and integrated community-based services. Ensure that high quality and safe care across every level of healthcare, including home care. And I think we need to focus on home care and long-term care. And we have to invest a little more in research, innovation, and indigenous technologies. There's something that we are not very good at. We need to invest in research. And finally, as I mentioned earlier, we need to build climate resilient, sustainable health systems. So, in a nutshell, if you ask me in two words, that we should start. The mistake we make is that we should stop treating disease. We should start preventing it.
Mm.
Not stop treating, continue treating, but ensure that you prevent it.
Right. Any suggestions for Home Care Association of India, since you've been leading
No,
so many?
I think, see, this is going to become a very, very big segment of care. And I think in the next few years, hospital beds are going to are going to reduce. I mean, it may sound a little funny because now in Bangalore itself, some 8 or 9 new hospitals are coming up. But my feeling is that with the advent of technology and with the other resources and the lack of resources we have, that home care is really going to go up. That treatment is going to be at home, and the only conditions where you will have to go to a hospital is either for surgery for emergency treatment. So we have to ensure, and especially as a home care association, the important, very crucial thing is you have to ensure that quality care is given at home and work backward. Certifications. You can use. It is important for the safe. See, as you said, no, it's difficult to guarantee a safe environment for the healthcare provider, but it's also the other way because a lot of exploitation. So we must use technology, balance technology, privacy, and ensure that we provide a good environment for the healthcare provider so that ultimately the patient gets the best care. So I think we'll have to move towards certification, quality for all home care services. We already actually started doing that with NABH and QCI. In fact, I had a discussion in the morning and we'll loop you in because this is very, very crucial, especially for your.
One other thing, sir, I would wanted to you to look at how probably have some sort of a gadget device, a camera, to log in the work that they are doing, probably for the AI. But how do you look at it?
See, one of the innovations that I'm actually looking at, and I think will make a big difference, is artificial intelligence. One is intelligence integrated with preventive health. But again, when we are looking at ensuring that home care services are up to the mark, certified, and actually delivered with quality on the ground, we'll have to use some sort of technology, artificial intelligence. Uh, it's going to be difficult to do it without some human interface, which is necessary. So we'll have to figure it out. Something which maintains your privacy at the same time ensures that the patient gets the highest quality of service through a healthcare provider who is also working in a safe and good environment.
Yes, because that's one of the things we home care providers do talk about,
Mm.
providing security to the caregiver. Things have happened,
Yeah.
as well as ensuring that they get the quality care at home. So it's a very catch-22 situation
Mm.
with technologies. So we need to have a balanced approach for sure.
Mm. One of the things we have started now, I mean, this is not the solution. We have started doing, maybe you could also get into it. We have started training family as caregivers.
Right.
Sometimes there's a big mismatch, especially in when a patient with dementia and Alzheimer's, the family has no idea what the patient is going through. So we are working with HSSE to introduce. One is a volunteer program, and second is how do you train the family caregiver to take care of a patient. But then, yes, that will probably very small percentage of home care will be given through that.
Well, that's one of the very important component. family caregivers. Because anyways, I mean, people, family people do end up caring for their loved ones, right?
Mm.
So it's good that they're trained. Perfect. So, Dr. Thomas, you have given us a lot to talk about, and a lot to think about. Um, Thank you for sharing your time and experience.
My
Um,
pleasure.
any message for Home
Yeah.
Care Association of India?
No, let's work together and at the end of the day, ensure that we provide the best care through our empowered healthcare providers.
Thank you, sir.
Right.
Honor
Thank you.
on the
Yeah.
show. Thank you, sir.
Thank you.